Pediatrics presents.
Hello, I'm Dr. Jeffrey Kile.
And I'm Dr. Alvaro Reymunde.
And today, let's talk about influenza. And one thing, we can't forget is that influenza is going to be around this winter, and with COVID, we just don't want it to be forgotten.
Right.
And it's really important that people remember that it's out there and that, how to approach it.
Right, because we don't know how things are going to look. COVID has slowed down, then it's sped up, cases go down. Schools don't know what they're doing yet. So we really have to, take a good stance on this and have a plan and really try to mitigate what goes on
Correct.
with the flu season, because the flu is coming, whether we like it or not.
Right, and the impact of flu and COVID at the same time, we just don't know where that's going to lead and how it's going to impact even the healthcare system. Correct. And stress our emergency rooms at all. So it's a good point to talk about the AAP, or the American Academy of Pediatrics, has set out new guidelines or recommendations in response to the upcoming flu season that we're going to be having.
Right. So the American Academy of Pediatrics is still recommending routine influenza vaccinations for all those people that can get it, which is typically anybody age 6 months and older, as long as there's no medical contraindications.
Correct. And that is the best protection that we have against getting the flu. And this year, it's even more important, we believe, because we have a pandemic circulating, which is COVID, in addition to our upcoming flu season, which we do not know how that flu season this year is going to pan out.
And we don't know how patients are going to react with having COVID and influenza co-infection together.
If they can get it at the same time. The data, we really don't know much about it yet. One of the interesting things, though, is that with the use of social distancing, wearing masks, and hand washing, our main defenses against COVID transmission can also decrease our risk of spreading influenza, which is hopefully maybe a good sign that we might see this year. So for instance, in March, when COVID became a very big issue in this country and became a pandemic, we saw flu cases plummet.
Right.
And then in the Southern Hemisphere, currently where it's wintertime, like in Australia, and they've seen less flu this year, and they don't know the exact reason why. It may be because everyone's social distancing, washing their hands and wearing masks, but it could also, though, be on the flip side that people are not going for medical care because they're afraid to go to the doctor's office because of the COVID pandemic that's out there. So it's not really clear yet, but the hope is, that if everyone does the right thing, we could sort of mitigate a very bad influenza season, but we don't know.
Absolutely. And, the same way we prevent any viral infection, hand washing, good hygiene, and just kind of staying away are ways that we kind of mitigate any viral infection anyway. So hopefully we will see a little bit of a decline with the flu cases. I know that in our office, we have been seeing quite a few less sick patients, whether it's because people don't want to come into the office or because they're truly not getting as sick. It's kind of hard to tell, but I have had some parents tell me that this year their kids have not been as sick as previous years. So fingers crossed, we'll see what happens.
That's right. And with the flu vaccine, getting back, remember we were talking about Dr. Reymunde, children 6 months and above are eligible to get their flu vaccines, except in very rare scenarios. And the important thing also to remember that if you've never had a flu vaccine and you had not gotten one after July 2020, that you need 2 vaccines.
Yes.
So if it's your first year getting the flu and you're age 8 or less, you need 2 doses given 1 month apart.
Correct.
Or what about if I'm less than 8 years old and I had 1 vaccine last year? Do I need to get 2 this year? The answer is you need 2. So last year's dose, unfortunately, doesn't count. If you did get 1 dose in July of 2020, then that counts for this flu season moving forward. So, but if you had one, say last March, and you were hoping to get the second dose and you never had it or never got it, then you still need 2 doses.
Right. And one of the reasons for that is because the flu strains change every year. And with the flu vaccines, what we do is we create a guesstimate as to what will probably be circulating for next year. And actually for this year's quadrivalent 4-strain vaccine, 3 of the strains have been changed. 3 of them have been new. So there's 2 new A strain and 1 new B strain that have been added or that have been modified for this year's flu vaccine.
Right. And all children get the quadrivalent vaccine.
Every children will get the quadrivalent. There is no trivalent flu vaccine for children this year.
Sure. So let's move on to, so we discussed the vaccine, and we discussed actually with COVID that to prevent the spread is good, and it's always been that way, good hand washing, but now this year layered on top of that, people are going to be social distancing and wearing masks, which hopefully will help, but we don't know. But then if you get the flu, what's the treatment, right?
Right. What can we do?
What can we do for flu?
So, as with any viral infection, for mild, moderate cases, we treat supportively. We make sure we stay hydrated. If the fever is very high or it's really making us feel down and, we have poor appetite, we can do some antipyretics like Motrin or Tylenol or, acetaminophen, ibuprofen and things like that. But what about antiviral medications? So Tamiflu is one of the major brand names out there that people are familiar with.
Right.
Who gets these? Who doesn't get these? Should we get this?
Right. And a lot of parents call the office when their children have flu and want Tamiflu. And we just wanted to discuss a little bit that with you. So Tamiflu is indicated for pediatric patients 2 weeks of age, actually, and older. So we could give it to very young children if we deem it's necessary.
Right.
And we really, with Tamiflu, have to understand what it is. And Tamiflu is not an antibiotic. So antibiotics work by killing bacteria and curing us of the ailment. Like a strep throat, we take it to cure our strep throat, to get rid of our ear infections. But Tamiflu is an antiviral medicine. And what it does is it prevents the influenza virus from attacking our cells in our body. It doesn't kill the virus like the antibiotics do. So therefore, it does not cure us of influenza. It actually decreases the duration of symptoms that we have by 1 to 2 days.
Correct. And that's all it really does. So medications like that will make us feel a little bit less sick, potentially, in theory, and like Dr. Kile just mentioned, decrease the duration of the illness by 1 or 2 days.
And then also, you have to give it within the first 48 hours of your symptom presentation.
Correct.
So if you give Tamiflu after 48 hours, there is 0 data from the CDC
Correct.
that says that it helps decrease your duration of symptoms in any way. So it's important that if it's going to be started, needs to be started early. So that's one of our decisions when, as pediatricians, when we decide who we would offer Tamiflu to, that's one of them.
Yeah.
And then also, what else?
So one more point with that, I think one of the reasons why we have to do it within the first 2 days, with the first 48 hours, is because after 48 hours, there's already so much virus that has replicated in our body that, it's just not worth it. It's not going to make a big difference.
Correct.
But so let's say, we do have this medication, who should we give it to? According to the AAP and I guess the CDC, there's a few scenarios where we can consider giving Tamiflu. The most obvious would be if you're sick enough to require hospitalization, if you're in the hospital.
Right.
Or if maybe you live with somebody that's immune compromised, or you yourself are immune compromised, such as you have a chronic illness that, chronic heart or lung disease that you live with.
Mm-hmm. And then also, we have to consider when we give Tamiflu the side effect profile.
Yes.
Because that's really important also. One of the common side effects that I think we see with Tamiflu when we give it is nausea, vomiting, diarrhea. And that's not a very common symptom of the flu.
It's not.
So one of the things we worry about if we're giving Tamiflu to children that may be able to, that have a mild case or may be able to fight it off themselves? Are we just introducing more symptoms
Right.
and maybe making them feel a little bit more sick? And the only benefit is that we're decreasing their symptom duration by 1 to 2
Right.
days. So is it worth it?
It always reminds me of those medication commercials that you see on the TV where the side effect profile is 3 pages long. And are we, are the side effects potentially worse than the actual illness?
Mm-hmm.
So there's a lot of pros and cons that we have to consider
Right.
when we prescribe Tamiflu.
And the other thing with Tamiflu also is that it doesn't decrease your infectivity rate to other people.
Right.
So by getting Tamiflu, you still are shedding that virus
Right.
and can infect other people. So it's really not a benefit. So I think every patient that requests Tamiflu, it's worth a discussion to sort of
Absolutely.
see if it fits for them. But there are considerations to say that maybe you're better off treating your flu just with some good old-fashioned hydration and Motrin and Tylenol to get through. And actually, most children that are well can get through with
Absolutely.
just that without
Absolutely.
needing the medicine.
Tamiflu also has a little bit more significant side effects. Some people have reported hallucinations even. So it's not a medication that we like to prescribe unless the patient really needs it or we really think the patient will benefit from it.
Right. And there's also even a concern that on a public health standpoint that, the more antivirals you give out, can the strains then become resistant to the
Right.
medicine. So just like if you give out too much amoxicillin, then the strain of the bacteria gets resistant to it.
So we talked about the flu, the different strains that are that have been changed with the vaccinations, how to treat it, what to do. Why don't we talk a little bit now about some of the differences between influenza and COVID? Because they're both out there. We're going to be seeing both of them. How do we know what's what?
It's very difficult because many of the symptoms are the same. So the symptom onset with COVID is typically between 5 to 14 days. So it's a much longer time frame where the incubation period with flu is really only 3 to 5 days.
Right.
So there's a longer incubation period. And then with COVID, oftentimes you see a fever first and then a cough. But then in flu, sometimes you see the cough before the fever. Now, these aren't totally ironclad scenarios, but they're just more general.
Kind of things that we've been seeing maybe. So basically the symptoms overlap a lot. So basically I think the best advice is if you're feeling sick, call your doctor for further advice. If you potentially have COVID and it's a mild case, we may not necessarily need to see you in the office. So I think the best bet would be to call the office and see what the next steps should be. Mm-hmm. Because like Dr. Kile mentioned, the symptoms are fairly similar and it can be a little tricky to decide which is which.
We hope you enjoyed today's video on flu and the seasonality of it. We would like you to subscribe to our YouTube channel and continue to like our videos because there'll be more coming.
Please comment down below as well.
Thanks.